by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Tonight we are talking about migraines. The National Headache Foundation estimates that 28 million Americans suffer from migraines. Women tend to get them more than men, often suffering these horrible headaches several times a month. These migraines can last for several hours or even several days. Now, it's unclear what causes them. Here to tell us more about migraines, how to treat, and most of all, how to prevent them is our favorite doctor, Express Care's Dr. Jitka Lom. Thanks, Doc.
Thank you.
So migraines are just really painful headaches. It's not your dull, headache. How can you tell the difference from just a normal headache to maybe that's due to fatigue and tired to actually a migraine?
A migraine, you're right. Well, migraine headaches are recurrent. They just happen once. They keep happening over and over again, and people start noticing that there's certain triggers for them. But the characteristics of a typical classic migraine is that they're one-sided. Only one side of your head, or especially your face, is in incredible pain. It tends to have a throbbing characteristic. People tend to also have light sensitivity. They can't stand the light or the noise, and they also feel very nauseated, and they may also vomit. It's an extreme experience. They may also have dizziness with it. They may have weird sounds that they can hear or flashing lights that they can see before the headache comes on, so they know that that's called an aura. They know that it's coming, and then once it hits, they're down, and that's going to be, at least a few hours, if not, like you said, a few days of suffering. It's extreme.
Okay, and so what are some of the causes? I mean, I think what I was reading is there's no actual, you can't pinpoint just one particular thing.
Yeah.
It could be a variety of things.
Yes, there is a variety, and a variety of theories of what really happens. Some people think it's more almost like a seizure where part of the brain is too sensitive and it'll fire off, and then a whole bunch of really toxic chemicals get released in your brain. Mm-hmm. And then because of those chemicals, the blood vessels in your brain swell. So there's all this pressure in your head and the throbbing. It's kind of like your heartbeats in your head. Very, very severe symptoms. But things that trigger it are certain foods, stress for sure, lack of sleep. These are things that may bring on a migraine for people.
Okay, and so why is it that women often, I was reading up on hormones and headaches and the connection there, mm-hmm. and as I mentioned in the intro, that women tend to get migraines more than men.
Much more than men, especially in the childbearing years, again, because our hormones fluctuate so much during the month. I often say we're a completely different person at the end of the month than we were at the beginning, and sometimes partners might agree, but anyway, as far as the hormones, we know there's a link again between estrogen levels and migraines, and when they're not even, people will be more prone to headaches, especially at the time of the PMS. About a week before your period comes, many women will suffer from migraine.
And I also read that sleep deficiency can actually mm-hmm. be a factor or a cause.
Yeah, well, sleep deprivation or sleep deficiency, even sleep apnea, can definitely trigger any headache, but certainly migraine headaches. And remembering again that you may just be tired from jet lag or whatever, and that's just a plain headache, pressure here. But when it's the one-sided and associated with the nausea and the vomiting and the visual disturbances and all that, that's migraine.
So I know my mom suffered through these when I was a kid, and I just, remember she would be laid up in bed for a couple of days.
Yes.
And one of the things that her doctor had her do was to write down what she was eating to see if there were certain food triggers. And most people wouldn't think about that. You eat, and then you get a really bad migraine. You don't ever really think oh, what did I eat?
Yes.
So that's something that's important.
It's really important. And again, it's really hard to sort out because we eat such a variety of foods. But MSG is a huge trigger. Caffeine for some people, things that have really strong flavors like strong cheeses, chocolate. So for some people, coffee, caffeine. What was your mom's? Did she find out?
She didn't find out.
Yeah. It's hard. Certain people also have food allergies. Sometimes when they might eat, for example, wheat, that's the one that comes to mind, wheat or yeast, that will trigger off their migraine. They'll know they can't eat pickled things, for example.
Okay,
Yeah.
So let's talk about prevention. Obviously, people don't want to get these because they are so painful and sometimes debilitating. So what is the best way to prevent getting it?
Well, I think you're looking at sort of two categories of prevention. One is the pharmacologic, we mean no drugs. That means sleeping enough, resting enough, getting exercise, a proper lifestyle, not eating the foods that you know will trigger you, and trying to minimize your stress through things like, again, exercise, laughter, and then other things like meditation. And these have been studied, and they really do help. If people practice breathing techniques, practice daily meditation, they reduce the number of migraines they get almost as much as if they take pills. So that's really good, because that's free. And then if that's not working, then we can, again, move towards medication. And there are really effective medicines that you take every single day. Now, if you get more than 2 migraines a month, you should really consider it. Instead of waiting for the terrible headache to come, take a pill every single day to prevent it. And it does work. And they're quite inexpensive, actually, and pretty much don't have much side effect. Some of them are sort of more like a blood pressure medication, which is another trigger, right, if you have high blood pressure. So you can take these medicines to prevent. If the migraine does break through, then you would have what we call abortive therapy, not in any way except for to destroy the migraine when it comes along.
Okay, some serious stuff. So
yeah, I mean, some people's migraines are not that severe in that they can be controlled with a simple thing like Motrin or Tylenol even, but many times it's really quite severe, and they have to have prescription medication. A lot of these medicines end in the word tan, such as Imitrex, sumatriptan is the generic name. These are prescription drugs, and some of them are very costly. So we always try to do the less expensive things first.
So kind of track down what you're eating and look at the other ways that can maybe help reduce the cost of treating this. All right, well, we've got to take a quick break, but we will pick up our discussion on migraines when Healthy Living returns.